People don't usually miss serious symptoms because they ignore them. They miss them because the symptoms don't look serious at first. Most dangerous conditions don't begin with drama. They begin quietly. A discomfort that seems manageable. A signal that feels vague. A sensation that doesn't match what we expect an emergency to feel like. And that's where the real problem starts. Because most people are trained informally, culturally, to wait until pain becomes unbearable before taking action. They assume serious problems announce themselves clearly. They expect obvious warning signs. Sharp pain. Total collapse. Something undeniable. But medicine doesn't work that way. It rarely gives you a single, clear signal. Instead, it gives you patterns. And if you don't know how to read those patterns, you don't recognize danger until time is already working against you. At first, people usually try to rationalize what they're feeling. They assume it's stress. Something they ate. A bad night of sleep. They tell themselves it will pass. And sometimes it does. But the frustration begins when the symptom doesn't fully go away. It changes slightly, moves, fades and returns. It's not strong enough to justify panic, but it's persistent enough to create doubt. So they wait. They look for reassurance instead of clarity. They search for the one sign that would prove it's serious, and when they don't find it, they relax. Temporarily. Meanwhile, the body keeps signaling. Quietly. Consistently. Without urgency. This is where many people get trapped. They assume that intensity equals danger, and subtlety equals safety. But in medicine, that assumption is often backwards. Some of the most dangerous situations don't cause immediate pain. They cause imbalance. Confusion. A sense that something is off, but not clearly broken. Doctors are trained to notice this difference. Not by guessing. Not by intuition alone. But by watching how symptoms behave over time. The visible symptom is only the surface layer. Beneath it is structure. Before anything becomes an emergency, it usually follows a pattern. The pattern might be progression symptoms slowly worsening instead of resolving. It might be inconsistency symptoms appearing unrelated but connected underneath. Or it might be disproportion, a reaction that doesn't match the apparent cause. Most people focus on what hurts. Doctors focus on what doesn't make sense. They don't ask, how bad is the pain, first. They ask, does this fit together? This is the part most people never learn. Surface explanations are comforting. It's probably nothing. Structural explanations are unsettling. Why is this happening now, in this way, in this place? Doctors delay conclusions on purpose. They look for what's missing. What should be there but isn't. What should improve but doesn't. And here's the turning point most people never make. The real issue isn't recognizing symptoms. It's recognizing patterns that shouldn't exist. A headache isn't dangerous by itself. A headache that behaves differently than your normal headaches is. Fatigue isn't alarming. Fatigue that doesn't respond to rest is. Pain isn't the signal. Change is. Once you understand this, something important shifts. You stop asking, is this serious enough, and start asking, is this behaving normally? That single change in framing reduces panic and increases accuracy. Doctors don't rush because they're calm. They're calm because they're systematic. They don't need certainty to act. They need deviation. This doesn't mean assuming the worst. It means removing false reassurance. Many people delay action because they're afraid of overreacting. But doctors are more concerned with underreacting to the wrong pattern. Especially when time matters. They know that waiting for certainty often means waiting too long. This is why early medical decisions are rarely about treatment. They're about observation. About timing. About deciding whether something deserves attention now instead of later. At home, this translates into a different kind of awareness. Not checking symptoms constantly. Not diagnosing yourself. But noticing when your body stops following its usual rules. A symptom that escalates faster than expected. A discomfort that spreads instead of localizing. A problem that improves, then suddenly returns. These aren't dramatic signs. They're structural ones. Understanding this removes guilt. It removes blame. People don't miss serious symptoms because they're careless. They miss them because no one taught them how medicine actually thinks. Doctors don't wait for pain to convince them. They wait for patterns to reveal themselves. And once you see that, you stop treating your body like a collection of isolated sensations and start seeing it as a system, one that usually warns you long before it collapses. This perspective doesn't give you answers. It gives you orientation. It helps you decide when waiting is reasonable and when waiting is risky. That understanding is often what makes the difference between acting early and acting too late. If you want a more structured breakdown of how professionals evaluate symptoms over time, there's a practical framework linked in the description. And if these kinds of explanations help you think more clearly about health decisions, subscribing will keep you connected to future breakdowns like this. Sometimes, the most important medical skill isn't knowing what to do. It's knowing when not to ignore what your body is already telling you.